Good evening and welcome to the first Zoom meeting of Healthcare Justice North Carolina. And although it is nice to never leave the comforts and warmth of home, and nice to have the option of leaving a meeting anytime and no one notices, and I hope none of you do that tonight, I personally hope that this is the first and last Zoom meeting for Healthcare Justice North Carolina. I do not know how all of you feel, but I would gladly exchange wearing my warm, cozy pajamas for a warm, cozy greeting of a live person. I'm glad you're all here and all ears for tonight's presentation, Pandemic, Health Inequities, and Reckoning with Racism, followed by update on Medicare for All. I am Denise Finck-Rothman, a family physician for over 40 years, currently in charge of an opioid addiction treatment program where my patients struggle to find the money to pay for their appointments and their treatment. That is why I am part of Healthcare Justice North Carolina and asking all of you to help move improved Medicare for all from a dream to a reality for all of us, for all Americans. First on the agenda tonight is our chair, Dr. Jessica Schorr Saxe, also a family physician of 40 years, who with great determination co-founded Healthcare Justice over 10 years ago. And her fearless and tireless leadership has kept us going and growing. She will start the evening by introducing the Board of Healthcare Justice North Carolina.
Great. Thank you so much for that nice introduction, Denise. And I still don't understand this reference to pajamas. You don't look like you're actually wearing pajamas.
This is them. I took them off. It was just for show.
Got it. Okay. If time permitted, I wish that I could introduce all of our wonderful board one by one, and I can't do that. But what we are going to do is you're going to see a picture of our great board. And then after that, you're going to see a list of everybody who's on it. So you can look for the names, and you will also see, when that goes up, what committees they chair. So I want to talk to you a little bit about what's happened in the last year. And as you might imagine, Medicare for All advocacy has been a little challenging in the last year, as has just about everything else. But we have been working, and there are several things to report. First of all, with regard to the state, the really exciting news is that there's now a North Carolina Medicare for All coalition that has 38 member organizations, all of whom support Medicare for All. And many of our members have been actively involved in that. And then what I want to do is talk to you some about what our actual committees have done. I'm going to tell you some of the things that they've accomplished. And then I'll tell you what they have planned for the year to come. And I hope that you will listen to this with an ear for something that you might like to get involved in and join us in. So we have a legislative committee. They've made visits with members of Congress, candidates, and county commissioners, networked with community leaders and organizations to educate the public on Medicare for All. We were part of bringing Don Berwick virtually, who is a national expert who talked about health disparities. Some of you may have participated in that. We've been active participants in the North Carolina Medicare for All Coalition Legislative Committee, and we've had postcard writing and text banking events to support Medicare for All. And in the year to come, that committee expects to do more of the same and to plan some outreach to candidates and public officials. Our communications committee is very active. They send out our newsletter with updates every couple of weeks, which if you're a member, you should have been receiving it. And they keep up with our social media presence. A big accomplishment is that they've been doing videos with personal healthcare stories, which you can see on the Healthcare Justice and see Facebook and Instagram pages. And they created the hashtag Why Medicare for All Now YouTube channel, for videos. And all of these links should be showing up in your chat at some point. And in the year to come, the plans are to expand the videos to a national audience and to establish a North Carolina-based celebrity influencer strategy. Our membership committee was very active before the pandemic, doing lots of in-person events. And they started off 2020 with a bang, and we marched in the Women's March and then the MLK March. And then guess what? We didn't march in any marches anymore after last year, but we've used marches and such other meetings as ways to recruit members in the past. And they've also scheduled like three meetings a year in which we also recruit members. And under Denise's able leadership, they're looking forward in the year to come to go back to more in-person meetings and be able to recruit more people to our cause. The Education Committee has had numerous presentations, including to Duke Law and med school, and has gone as far afield as East Tennessee Medical School. They are looking forward to more in-person events in the year to come and are always looking for places for us to talk about Medicare for All. So if any of you belong to any organizations or know of any meetings that would like to bring us, we would be glad to do that. And then last, but certainly not least, are our student chapters. So, which are Queen's University of Charlotte Healthcare Justice and Healthcare Justice at UNC Charlotte. And both of them became chapters of our national organization, Physicians for a National Health Program, and were among the very first undergraduate organizations to become chapters. So we've been proud of them anyway, but we're very proud of that. Both of them hold meetings and they discuss various issues, and UNC Charlotte also does service projects. They've worked together and they've created a cultural competence committee that's for our whole organization, which has discussed issues like disability, the pandemic, the racial caste system, and plans to discuss more issues. And they are very active members of the Why Medicare for All Now video collection. I hear a sort of rumor that sometimes they even help some of the older members along with these technical tasks. So we encourage you, if you're interested, to join us at any of our committees.